Hey, welcome back to another one of our virtual health fair interviews. Today we're sitting down with Patti Cook with the diabetes. She's a diabetes educator at UHC. Thank you for joining us today.
Hi, Michaela. It's my pleasure. I'm glad I could do it.
All right, so let's jump right in. Our first question is, so what is the main goal of your education program?
The main goal of our education program is to arm patients with the knowledge to properly manage their diabetes to the best of their abilities. We want to lower A1Cs, prevent or reduce diabetes complications, and improve their quality of life.
Great. So about how long does it take to complete the outpatient diabetes education program, and what kind of knowledge and skills will be gained from that class?
Okay, so there are two different ways that they can go through the program. One is through a group session, and the other is a one-on-one session. So it varies a little bit in how we do that. With the group session, which is my preference because they make those connections with people going through similar experiences as them, or they meet people who have had diabetes for a longer period of time and kind of give like a personal account as to what they've experienced with diabetes. So it hits home, closer for them instead of me just getting up and presenting facts and telling them what can happen. When they are able to talk to other people going through similar things as them, and they can see, oh yes, that does happen. Complications are real. That's my preference, but we do offer a one-on-one session too. So the way it works for a group session, it's a 9-hour class. Depending on who is providing that class, it can be done in many different ways. Here at UHC, we do 2 days back to back, and each day is approximately 4.5 hours long. It starts about 8:30 in the morning and runs till 1 p.m. We take several breaks. I encourage them to bring a support person with them. Diabetes is a lot. There's a lot of information that goes along with diabetes, and it can be overwhelming, especially for those who are newly diagnosed. Sometimes they pick what they hear, or maybe they hear it incorrectly. They hear what they want to hear sometimes. So it's important to have that support person. They may pick up on things that maybe the patient missed out on, or they have someone, to assist them with their meal plans. So the 2-day class, about 4.5 hours each day, we encourage them to bring a person. We also encourage a snack, so they can eat while they're there without judgment. We're there to learn. And then after those 2 days, they are sent a letter about a follow-up class, which is approximately 1 hour long. And we do that 3 months after they finish that initial diabetes self-management education program. So then they come back for a 1 hour follow-up. We talk about, how they've progressed. During that initial visit, they set a goal for themselves. It's encouraged by the American Diabetes Association, who accredits our program. So we set a goal. We revisit that goal to see if they've been able to reach that goal. And if they have, we set new goals. So it keeps them working towards something and improving their diabetes. If they have not been able to reach that goal, then we continue that goal and we talk about ways that we are better able to reach that goal. When we first set those goals, it's a measurable goal. So they'll say, give an example of what their goal would be. Maybe it's to monitor their blood sugars better. Well, how are you going to do that? You have to explain that the patient has to explain how they're going to reach those goals. And then how many times per day and how many days per week, so it makes them accountable. They have something to go by. So we revisit those goals at the follow-up. If they've not reached that goal, let's think of other ways that we're able to reach that goal. If this didn't work for you, what can we do now? So that's what we do at the follow-up class. The one-on-one session is a condensed class. They don't get the videos that we present in the 2-day group session. It's about 2 hours, sometimes we go a little over if there's lots of questions or if we need to elaborate on some things. But it's a 2-hour session. We still encourage them to bring a support person with them. They get all the same information. We're able to get it done in 2 hours usually because it's one person and we don't have a whole group of people asking questions, that you have to answer each one, or they're not communicating with each other. So it's more just, that one-on-one type deal. They also come back for the 3-month, 1-hour follow-up. And we review the same things, the goals, that we're trying to reach, all of those sorts of things. Does that answer?
Yeah, it does. Perfectly. So can you touch upon like some of the other medical problems that having diabetes puts you more at risk for having?
I can, yes. Let me. So diabetes really affects every system in our body except our lungs directly, but the lungs can be affected secondary from other complications of diabetes. Heart disease is a biggie for people with diabetes. The American Heart Association and the American Diabetes Association actually just partnered to bring awareness to just how connected heart disease and diabetes really are. People with diabetes are twice as likely to have heart disease and often have other complications such as high blood pressure, high cholesterol, high triglycerides, which also contributes to heart disease. People with diabetes are also 2 times more likely to experience a heart attack or a stroke than those who do not have diabetes. According to the National Institute of Diabetes and Digestive and Kidney Diseases, about 1 out of 4 adults with diabetes has kidney disease. But managing blood sugars and getting them close to the recommended target ranges suggested by the American Diabetes Association, which is fasting or pre-meal, a blood sugar of 70 to 130, or a 2-hour post-meal blood sugar of less than 180. They can decrease the risk and stop the progression of some of these diseases. A 1% drop in their A1C can reduce the risk of small vessel disease, such as eye, kidney, and nerve damage by 25 to 30%. So those are huge numbers, just a 1% drop. Once these people are diagnosed with diabetes, our goal is to get them under the 7% range for an A1C.
Right, thank you. And could you outline some like simple lifestyle changes that you would recommend to a diabetic patient?
Eat right. That's always important. That's one of the big tasks when they come to class. We get them a meal plan. We teach carb counting. If carb counting is not for them, we teach the plate method. So I brought one to show you. So if carb counting, it stresses some people out. It's hard. It takes a lot of work. So they can always do the plate method. With the plate method, half of your plate would be a non-starchy vegetable. A quarter of your plate would be your protein, and the other quarter of your plate would be a starch, whether that's a starchy vegetable or rice or pasta, whatever that starch is for you. And some meal plans still allow for fruit or some milk on the side, some extra carbs that they can fit in. So eating right plays a huge role in managing their diabetes. Keep moving. That's another big one. The American Diabetes Association recommends about 150 minutes of physical activity per week. And if you break that down, that's about 30 minutes, 5 days a week. They do recommend that they not go any more than 2 days of not exercising in a row. So we really encourage physical activity, something that breaks the sweat, gets the heart rate up. But of course, they need to get cleared by their primary care provider prior to any exercise regimen. Adequate sleep, 8 hours per night. Whenever we're not getting enough sleep, those cortisol levels go up, which can increase our blood sugars. So adequate sleep is important for people with diabetes. And then the really big one is taking those medications as prescribed. Not trying to decide what works best for you, but going with what your healthcare provider has suggested, monitoring your blood sugars, those sorts of things.
All right. And how can someone get the necessary supplies they need to like monitor and control their diabetes, like a glucose monitor?
Okay. So it's vital for people with diabetes to have a primary care provider, keep their visits. That's how they're going to get those prescriptions that they need for their medications, stay up to date with those things. So they can purchase like a glucose monitor, test strips, lancets over the counter. However, if they had a prescription, their copays may be, remarkably less than what it would be if they're just buying something over the counter. So that's important for them. People with Medicare, sometimes they meet the donut hole. I don't know if you've ever heard anybody talk about that, the donut hole. So basically what that is they have met their cap for medications and diabetic supplies and those sorts of things for the calendar year. So they're not able to afford those medications. And I just want to encourage everyone to not go without medications. If you find yourself in the donut hole, if you have Medicare, or if you don't have Medicare and you find yourself not being able to afford your copays, or if you possibly lose your insurance, never go without your medications. Contact your primary care provider or a diabetic educator like myself. There are programs out there that we can get you signed up for and help you get those medications. Or maybe you just need to switch some medications around and we can get in touch with your primary care provider and get that taken care of for you. So I just encourage people to please, please, please never go without those medications. Reach out to people like myself and we can help you get those things covered.
And so for those who want to get involved or enroll in your program, like how would they go about doing that?
So the way they would get enrolled in my program is through referral from their primary care provider. So they can always call the office of their primary care and ask for a referral to diabetes self-management education. And the doctor will send over, or the nurse practitioner or PA will send over a referral, and then we will get in touch with them, either by phone or letter. Typically, we send out letters inviting them to call and set up an appointment. They can, when we were having group sessions prior to COVID, we would just list several dates that we were offering classes, and they could pick from that to what best suits their schedule. Now that we're doing one-on-one sessions, there's a number listed, and we encourage them to call to set up that appointment. Typically, if it's a gestational diabetic, we usually call them and ask them to schedule. So we're making that contact with them and getting them in as soon as possible. So they can ask for a referral. If they're not able to obtain that referral from their primary care, they can always call my office. My number is 681-342-1862. They can always call me, and I would be happy to reach out to their primary care provider and obtain that referral for them.
All right. And last but not least, and I know you just mentioned this briefly, so how has COVID affected your ability to provide services to people?
Well, when COVID first hit, we kind of put a stop to all classes. No extra people were coming into the hospital. Our classes are offered here at the hospital. So until we developed some policies and procedures and got them in place, there were no classes. We have I'd say in the last few months, we started back up with some educational classes. There are no group sessions currently. They're all one-on-one sessions. And they can bring that support person with them. Everyone's required to wear a mask that's in attendance. We do the classes in my office, and we maintain a 6-foot social distancing from one another. So, and they still have all the same information. It's kind of a more intimate setting because it's all focused on them. It's very individualized.
All right, thank you. That sounds great. That's all the questions we have for you. So thank you so much for your time.
You're welcome. It was good to meet you, Michaela.
It's good meeting you too.
And thanks for giving me the opportunity to meet with you and talk about the program.
It was our pleasure.